here. The Delta variant is now the most common strain of coronavirus in the United States.
It was first identified in India. The CDC saying it's more contagious, right, more virulent than previous strains. And in parts of the country with lower vaccination rates, we're seeing that Delta variant leading to a spike in new cases.
Joining us now is Dr. Shereef Elnahal, President and CEO of University Hospital in Newark. Dr. Elnahal, thank you so much for being with us this Wednesday morning.
Thanks so much for having me.
Yeah, so talk to us, doctor, about this concern surrounding this new variant. We've heard Dr. Anthony Fauci fearing that this would become the most dominant strain of COVID, and here it is. Who should be concerned here? Who is the most at risk, and should we as a whole feel safe if we did get vaccinated?
Well, there are a lot of reasons to be concerned about the Delta variant if you are unvaccinated. And I want to make sure I reinforce that as much as I can. It is twice as good at spreading from person to person than the original virus, which filled up our hospital in Newark just about a little over a year ago. And it's important to understand that if you are vaccinated, you are still protected against this virus. There have been some reports recently that the overall effectiveness is a bit lower than previous strains of the virus, which is true, but it's still well over 90% effective at preventing hospitalization from COVID-19. This was a series out of Israel that was just released over the last couple of days. And so important thing to emphasize is that vaccination still protects you. And because there's a little bit lower effectiveness to vaccination overall for getting the disease, that only increases the importance of vaccinating more people faster. I know it's a little bit hard to process that, but that's how the public health works. And it's important for folks to be protected to prevent the variant from getting worse or developing further mutations, and certainly from preventing severe illness and death.
And Dr. Elnahal, I know that some people are going to hear, if I get vaccinated, I can still get sick with this Delta variant. So we need to sort of cut through that. And how do you continue to fight vaccine hesitancy? We've seen President Biden come out and say we need to do more in-person, door-to-door, pop-up clinics. How's that working in Newark?
Well, I think we have to remind people that not getting vaccinated is a choice, and it's one of the riskiest choices you can make right now. Getting the Delta variant, if you are vaccinated, is much less harmful for you than getting it when you're unvaccinated. It's more severe. It can transmit to your family and loved ones more easily. And so I think that if we frame it as a choice and being unvaccinated as a choice that's very risky to you, that should work. And we've been canvassing in our community here over the last several weeks. We had a successful vaccination event in Irvington, very close to Newark. It's an area that was particularly under-vaccinated. And going door to door, reminding folks of the facts and scheduling them in advance for a pop-up vaccination clinic is a method that actually works. And I think the president is in tune with what is working now for the remaining folks who may be hesitant. And so I think that's encouraging to hear, and we all have to get on board with that strategy.
Right. Dr. Elnahal, we know there's a lot of concern about the kids, right? Those kids under 12 who cannot yet get vaccinated. How susceptible are they to this new variant?
Well, I think everybody's more susceptible based on the data so far. It's important to follow precautions as outlined by school districts, by local entities, including state and federal government. It's important to understand that if you are vaccinated, that you are also protecting your own children and your own loved ones from getting the Delta variant, which would in turn protect their classmates at school and in other settings. And so again, just reinforcing that vaccination will protect you and everybody around you.
And Dr. Elnahal, obviously we want to keep our kids safe during this time period before they're able to access the vaccine. One of the things that I noticed is my family was trying to travel internationally. I've got an 8-year-old son. He doesn't need to even have a PCR test to go overseas. They're just saying if you're under 12, you don't have access to the vaccine. Is that sending the wrong message that we can let our guard down?
Well, I think it adds some level of incremental risk. But again, if you have a situation where you're traveling to a country or a place that may be of adequate vaccination levels, and thankfully the United States is near the top of developed countries, especially of our size, for vaccination, that it may not be as risky. But that doesn't work if you are unvaccinated and you have unvaccinated children. And so I do think if unvaccinated adults take that step and do that, then everybody is protected, including our children. And especially, it's important to understand that if you have kids 12 and older, they are eligible for vaccination, and they should be vaccinated because they're in turn protecting their younger siblings who are not eligible yet.
Yeah, and I think we can all role model for our kids. I know one of the things that we do is extra masking, even where we're not required to, just to let our kids know how important it still is. Dr. Shereef Elnahal, CEO of University Hospital in Newark, thanks so much for being with us this morning and digging into these finer points. Appreciate it.
My pleasure.